We are going to look at a hypothetical case, a female named Aisha who's struggling with addiction and trauma. So that's right up your alley, Vance. 28, and she is struggling with alcohol dependency and depression. And her background, she has significant childhood trauma, an emotionally neglectful home, and a history of abuse. She works part-time, often calls in sick due to drinking or to not being able to get out of the bed in the morning, and recently started attending church sporadically, but still feels like an outsider. Physical symptoms, she deals with liver issues, poor sleep, shakiness in the mornings. Psychological, she has PTSD symptoms, guilt, shame, depression. Spiritual symptoms, she's searching for something, hope, forgiveness. She's not sure what, but she feels pulled back and she feels weighed down and she's looking for something to lift her up. How would you two approach this person, and how would you work together to be able to navigate that person to a better place?
So, Chris, my first thoughts for you before we even begin to address trauma, with a person like this, I would want to begin building the idea of a hope that it can change for her. And I believe that requires spirituality. She is going to church, but she feels like an outsider. I would ask you, how can we begin by approaching a sense of community for her? I'm going to recommend that she goes to meetings, even if she chooses not to practice the 12 steps. She goes to at least a couple of meetings to begin building the community on that side. But I'm very concerned that she's going to church and even feels like an outcast there. So I would ask for your advice on that.
I think it would be very, very clear that that'd be one of the ways to begin to help her. The issue would be, again, depending on the circumstances of the particular church that I'm at, there would be need for either meeting with one of us clergy that could begin to help some of that need for feeling like an insider, to then also meeting with particular groups. But oftentimes people who've experienced PTSD will still feel like an outsider in a group. And so it'd be a short-term solution to begin to give that sense of community, at least a base of community would be a start. But then of course there'd have to be an addressing of the dynamics.
And I would want to work with her on the specifics of what comes up for her emotionally, mentally, and physically when she's at church or when she goes to a meeting, or even when I suggest it, what happens. I would want to understand, there's a lot of research into how your body interacts with memory and emotion and all different sorts of things. Cecil Van der Kolk wrote a very good book, The Body Keeps the Score. I would want to understand what's happening, even having the discussion. So where are you holding any stressors? Why? I would have a conversation about going to church or about going to a meeting and try to understand what's happening with her just talking about it. And then I would dig there psychologically to try and pinpoint some high level whys. What are some areas you think, why do you think this is causing you to tense up? Why do you think you're feeling nauseous? Well, and if we can find some high level things and begin to give her tools to feel comfortable when even thinking about certain things, you begin creating a felt sense of safety. And that's something you can build on, because ultimately trauma, especially childhood trauma, steals your ability to form your own felt sense of safety. And it leads to the behaviors like addiction and other things that you've developed to protect yourself in this unsafe world. So you have to begin to restore that. So I'd explore, why does this concept make you feel uncomfortable?
And I think on my side of things, I would probably begin by trying to understand her background in terms of the trauma, to understand and ask where she feels most connected to God, and in what aspect of God she feels most comfortable with. For us, from a Catholic point of view, I know that sometimes some people feel closer to the saints, whether they be male or female, but I know that those who have not had a positive relationship with their father can often feel a closeness to the Blessed Virgin Mary, even though she's not God, but just because they're looking for a female aspect in some regard. In which case, if the person isn't Catholic, I would recommend that they begin to look at the Holy Spirit from the point of view of the Hebrew understanding, which is that Holy Spirit is feminine in the Hebrew understanding and therefore could be seen as a mother figure. So I would look at where they feel most comfortable with God and then try to build on that to build a safe place for them, to have an understanding of safety with God. Because I wouldn't want to force somebody, if they've had an issue with their father or their mother, to try to relate to God in either a fatherly or motherly way where they're not capable, or if they've had an issue with a sibling, especially a brother, to try to relate to Jesus immediately, unless they've had very positive experience already of the Lord in that regard. So that's where I would try to complement the understanding of their trauma with their spiritual life, trying to build some resources for them in a safe place.
What sort of other providers or professionals might need to be looped into this person's life, into this person's healing journey?
On my side, medical, definitely for the depression. I would ask that she visits with her primary care provider to understand, or if she has a psychiatrist to help her, because I do believe very strongly from personal experience as well as my professional experience that medicine definitely helps the chemical imbalances in our brain, specifically in this case, her depression. If you can get her on a level playing field where her brain is behaving the way it's supposed to, it makes her work a lot easier for her. So I frequently recommend people talk to the doc.
Chris?
I think likewise, I would recommend that they're seeing their therapist, and that if they need to seek psychiatric drugs. The other thing too, on the spiritual side, I would sometimes recommend inner healing prayer, because sometimes there can be a breakthrough for them especially in imaginative prayer, where they're able to imagine what God might be doing or saying to them. This can be very powerful because oftentimes something they wouldn't even expect to experience actually happens, and there can be breakthrough with inner healing prayer. I did mention earlier that certain people who are trained in deliverance ministry could help if there's any spiritual component in terms of the negative spiritual aspect, in terms of the devil or any unholy spirits. They can pray and help the person be liberated from evil in that regard, as a complement, not as a sole remedy.
One of the things that often goes along with someone in this situation are a lot of unhealthy relationships, either with their family of origin or with their friends, and especially with the hypothetical case of Aisha, where she's feeling like an outsider, she's feeling depressed and lonely and all of that. How would both of you help her navigate through shifting her community to be more productive for her healing? Or how would you help her navigate people who might be detrimental to that process?
We can seek unhealthy relationships to confirm the reality that we're living in, or to give validation, even if it's unhealthy. So one of the first things I like to do with people is validate their individual experience. Like, what is happening with you is real and normal and okay, and then begin to help them to understand the impact that the relationships they're in is having on that and on them. Really, as a therapist, you're oftentimes the first healthy relationship, and the therapeutic relationship is a thing. You're the first healthy relationship they may have had in a long time, or ever in some cases. And so you're providing them a glimpse into what that can be like, validation and support, guidance in a healthy way, as opposed to a toxic way, which they're frequently very used to in the form of patients suffering from addiction. So in AA and in 12-step programs, they talk a lot about people, places, and playthings. Psychologically, what happens is experiences develop neural pathways in your brain that create patterns of behavior, create memories, create thoughts, emotional experiences, etc. And they've spent years developing these toxic pathways in their brain. So they have to begin to identify the strongest ones of those that would trigger them, for lack of a better word, into a craving, into a desired return to old behaviors. And you have to avoid them. And so a lot of times early on for the addict or alcoholic, it's really, I just can't go there. Like, the alcoholic can't go to a restaurant that serves alcohol. The addict cannot hang out with the friend who saved their life. And it's incredibly difficult. So that's again where the power of meetings come in, because it's a room full of people whose only objective is to keep you clean and sober today. And it's a beginning exposure to those healthy relationships. And it's why frequently in my private practice, I required people to go to meetings in early recovery to find that and begin to see what that is like outside of the therapeutic relationship. But certainly beginning, I have to model it.
I'd say that there's probably a lacuna in the church in terms of friendship, because a lot of times the people who are in church are also struggling with their own particular unhealthy relationships, and so they can mimic what they've grown up with. Basically, I would need, in the hypothetical case of Aisha, I would need to make sure that anybody who I would suspect is not quite in a healthy place, that they be aware of that person, and that she be aware of that person, and maybe not look to form a close relationship with that person, of course, without breaking any confidences. Then I would probably try to find her a mentor, or have her go on the Cursillo movement, because in the Cursillo movement, they do have a mentorship aspect that's supposed to continue throughout one's walk. So sometimes that can be helpful in terms of a retreat, in terms of discovering the love of God, and then also discovering a community of people who are in the same boat. Basically, anything that helps her to recognize that she's not this outsider, that she's not necessarily alone in ever having experienced trauma, PTSD, and addiction, and that others have walked that path before and are able to overcome with the help of God, I think would be a good place to start. And that's where I would probably look for helping to build those relationships. And I'd have, like I said, because there can be a lacuna sometimes in church in regards to friendship, we would have to sit down and really navigate that together.
So, looking at this kind of holistically and from a collaboration mindset for the hypothetical case of Aisha, what would success look like for her and for both of you in this process?
I mean, that is a very broad question. So success is very individual. The walk is very individual. Healing is very individual. So I can't determine what her success is. She has to. But to determine goals, I would ask her, what's not working for you? What would you like to see differently? And we would focus on giving her tools and connections and abilities and resources to be able to change those things. So that being said, that I try to put it in their hands. Like, there's a reason you came to see me. What can I help you with? And then success would really look like just them being able, and sometimes they're not able at first, and that's okay, but them being able to begin taking steps in those directions, and then seeing the rewards of the new behaviors, and then wanting more.
Chris?
I would say any increase of faith, hope, or love, either the ability for Aisha to experience the love of God and the love of other people, as well as to love God and other people back. Any increase in that would be success in varying degrees. So basically, we'd have to look at goals from step to step, but success would be measured in any increase, and then we would celebrate those successes along the way. Any increase of faith, hope, or love.